An overview of the patient with sickle cell disease. IT presented to the clinic with a chief complaint of increased pain to his arms and legs. He reported that he had been taking 400 milligrams of ibuprofen every 6 hours for 24 hours without any relief. He admitted that he had always had underlying pain in his arms and legs, but the pain has intensified over the past 36 hours. He states that he feels that he may have overdone it at the gym due to overexertion and failure to consume water. Past medical history. Since the age of 3, IT has averaged 3 painful sickle cell crises, but he has had as many as 10 attacks in a year. Since his teenage years, he usually experiences chronic low-grade pain in his arms and legs and in his back, but he reports that he has been able to cope with this by taking ibuprofen as needed. He's had a couple of surgeries. He had correction of hypospadias at 8 months, a tonsillectomy, asthma, chronic rhinitis for the past 2 years. He is an 18-year-old male who lives with his mother and brother, a recent high school honors graduate who will be leaving for college in the fall. He is currently employed part-time as a cashier at JCPenney. He denies any smoking, drinking, or the use of drugs, except for a trial of pot 2 years ago. He reports that he is not currently sexually active, but he tries to exercise as much as he can while maintaining a healthy and balanced diet. Family history. His mother and father are both alive and well, but both have a known history for testing positive for sickle cell trait. IT has one brother of the age of 17 with sickle cell trait. He is currently only taking 1 milligram of folic acid every day, flunarizolide 2 sprays to each nostril 4 times a day, and ibuprofen 400 milligrams as needed. He is allergic to aspirin. It gives him diarrhea, and he is also allergic to poison sumac. He was first diagnosed with homozygous HBS disease at the age of 11 months when he presented to the clinical setting with significant swelling and pain to both hands and feet. At that time, hemopheresis testing revealed a hemoglobin proportion of 86.5% HBS, 11.3% HBF, and 2.2% HbA2. When IT was 16 months of age, he was hospitalized with acute sequestration syndrome and splenomegaly. He was treated and discharged home without any further complications. He was also hospitalized with streptococcus pneumonia at the age of 30 and 34 months. He was treated with IV antibiotics on both occasions and discharged home without complications. He also had an episode of acute staphylococcal osteomyelitis of the left knee at the age of 13.